my name's Alex Cairns. I'm an academic clinical fellow looking at the management of women who've developed raised blood pressure in pregnancy after they've delivered their baby and once they've gone home from hospital. I'm a trainee obstetrician, so I work as a doctor up at the John Radcliffe Hospital, delivering babies and looking after women both antenatally, so whilst they're pregnant, and postnatally. Theme 5 of the CLAHRC is a broader span of research looking at developing technologies and different interventions to allow patients with all sorts of different things wrong with them to manage their own conditions. So looking at how we can use things like home blood pressure monitors, mobile technology, both apps and text messages, to allow them to have more control. So the idea really originated from 2 pieces of research that have been done within the department previously. So the main one is the Tasman studies, which are a series of randomised controlled trials looking at the management of essential hypertension, so older people with chronically raised blood pressure, and looking at how they manage that blood pressure and whether they can use a home blood pressure monitor and adjust their medications to get better blood pressure control. Those studies have showed quite convincingly that that achieves better control of blood pressure than GPs seeing patients as a one-off visit every 3 months or so. There's another study, pilot study, that's been done in the department called the BUMP study, which is looking at using home blood pressure monitors for screening for raised blood pressure in pregnancy. So the majority of women who develop raised blood pressure in pregnancy won't have had blood pressure problems previously. So they will enter pregnancy often completely normal and healthy. So then from those 2 sets of studies, the question arose, could we then use this technology in women who have developed blood pressure in pregnancy and use it in their management? And the view was that probably the period after birth was the most sensible place to start. So the feeling is that we need to demonstrate that this technology and approach works once a woman's given birth, and then if we can demonstrate that it's safe and effective in that time period, then one could look at whether it could be used during the period of pregnancy safely. We would hope that we will achieve better blood pressure control through more regular monitoring, and we know that home monitoring offers some advantages over monitoring either by a midwife or a GP in a clinic setting. On a kind of wider view of the NHS, I hope that you reduce a bit the burden on GPs and midwives in terms of monitoring blood pressure and down titrating medications during this period. What we're running at the moment is a pilot study to see whether intervention is feasible, so whether women are happy to do it, whether they're happy to be part of a trial, and then whether it, on a sort of basic level, whether it's safe and it works and is not obviously much less effective than the usual standard of care. What you hope is by taking the burden of the routine work off the GPs and midwives, that then when the woman who actually does need some input rings up and says, oh, I need an appointment, that they're better able to get that in a timely fashion.